I've struggled with this my whole life. Just made me so insecure. It's life-changing. Thank you, Dr. Lebowitz.
Good afternoon, this is Dr. Lebowitz, Long Island Gynecomastia Center, Long Island VaserLipo Center. Second case of the day. The first case was a 14-year-old boy from Florida. This is a local guy from New York, that is. And he comes in with gynecomastia. Now, he's not that bad. I mean, really is not that bad. But he really wants just a really defined, tight, small chest. And he's got gland in there, but he's got all this fat going on here. And after talking and stuff of that nature, it's a better operation, smaller incisions, less scarring with the Vaser, than opening them up and really kind of contouring this better. I'm going to give him the deltopectoral groove. I'm going to liposculpt, Vaser, high definition, get the edge of this this pectoralis muscle. So really give him a negative space here, positive space by the lats, positive space by the lateral aspect of the pectoralis major muscle, the inferior aspect here. Make a happy chest, a squared off chest rather than a sad chest, and obviously the same side. And I want to go up to his first rectus abdominal muscles here. I'm going to draw him in a second. So rectus abdominal muscle, the first 2 6-pack, the deltopectoral groove, shape and contour, mold, reveal, sculpt his chest to absolute perfection. So I'm going to mark him, I'm going to numb him, and you're going to see firsthand in the operating room what I do and what I do so well. This is the edge of the breast, lateral, inferior lateral aspect of the pectoralis major muscle. Turn this way. This is the lats back there. I'm going to scoop that way. Come over here. This is the lats over here. Going to scoop that way. Next, this is the, put this down here. This is the deltopectoral groove right there. Another deltopectoral groove right there. Perfect. We're going to not go above this. Give him a little rhomboid shape here. That's great. Now, this is, and that's that. That's probably the second. Come on down here. That's probably the second one. So, now, make a muscle. Good, excellent. Now bend over backwards. Okay, relax for a second. So, I think he's high. He's high here. Lift up your arm. This is the semilunar line right there. Semilunar line right there. Thanks. So this is the first, the second, and the third comes down a little bit more. We're not going to go that far down. It's going to, what I can reach is the first and second one. Probably a little higher actually on this guy. Reveal that one. Reveal that. Perfect. And bring this one all the way down this way and all the way this way. Now the serratus anterior, let's talk about the serratus anterior. Make a muscle. Relax, lift up again. So that's right here. So these are the serratus muscles. It's usually there's like 2 or 3 of them. 1, 2. The third one there. So let's see what you can do. This side I see a little better. Perfect. Perfect, perfect, perfect. And go right where it's numb already, right there. Do you feel it?
No.
And we pump you up.
Pump you up.
ring. And let's do it. You alright? You hear it good? Oh yeah. Smooth.
Like butter.
Suavecito. Get underneath that gland. There we are. There we are. Into the armpit. No fat armpits. Here with gynecomastia, I go way down here. This is gynecomastia surgery, man. That's why, I'm telling you, that's why I'm more expensive than other people, because I just don't do this when I do lipo. I go all the way around. Now we're lipoing. Let's see what it goes up to. So I'm liposuctioning and liposculpting. Beautiful. So this is, that's ground zero of the nipple, right there. Ground zero of the gyno is at the nipple. And this happened to have just popped out beautifully. There you go. Gynecomastia surgery. What?
Explosion.
Miss Scarlett, I know nothing about birth and babies.
I don't know nothing about birth and baby.
I dare other doctors to do this. That's why they come to me.
Yes.
So now we go Get some curve. Which way do you curve? Let's see what we can do with this. This is new. Dr. Lebowitz, Long Island Gynecomastia Center, Long Island VaserLipo Center. This gentleman, pre-op photos right now. And this is him immediately post-op. I vasored, liposculpted, lipo-contoured, lipo-revealed, lipo-defined his male chest gynecomastia. Look over here. We have almost 1.5 liters of fat out of him. And these are his glands right here. Perfect specimens of glands. And hope you saw how I easily popped them out after the vaser. This is amazing. Never recurrence, perfect results. Stealth incisions in the armpit and by the nipple here, right over here, where these will heal all self-absorbing stitches perfectly. But let's talk about my gynecomastia surgery. I just don't concentrate on here or here. I go from the shoulders to the abdomen, the lats in the back, all the way around. Look at the beautiful positive space here, the negative space right here, down to the lats. This is the latissimus dorsi muscle here, the lateral and inferior aspect of the pectoralis major muscle here, the deltopectoral groove right here, which I defined to give them that great groove to show off the beautiful muscle of the pectoralis major muscle. I now included the serratus anterior muscles, and when the swelling goes down, you'll have these sharp knife finger like serratus anterior muscles. But also please note the upper abdomen. I inscribed really the first and somewhat the lower, the first and the second inscriptions of the six-pack of the rectus abdominal muscle right here. This is the linea alba in the midline. I sculpted that, and this is the semilunar line that laterally down to the lower lats I absolutely sculpted to give that great negative space, that hockey stick shape. Look at, there's no glands here anymore. These are perfect. Now, make a muscle. Make a muscle with your pecs. Look at that. Look at that shape there. Now do a crunch. Make a muscle and do a crunch. Look at that. That is amazing. This is gynecomastia surgery to its best right here. So if you just want regular gynecomastia, go to somebody else who will just go over here, cheaper than me, and give you an okay result. You want real perfection. You want guaranteed results. You want more than just gynecomastia, really 4D high definition results of the male chest. Sculpt, contour, define, reveal the muscle, abdomen, deltopectoral groove, latissimus dorsi muscle, the pectoralis major muscle, the midline, the what's it called again? The semilunar line down. Get that great hockey stick results. That's what you're going to get with me, and I guarantee my results. So you have gynecomastia, you want a better chest, a more masculine, fit, athletic, happy, lifted chest, call me. Dr. Lebowitz, Long Island, New York, 631-424-0101, 631-424-0101. Thank you, and hope to see you soon. You had a great result, and that's what we got out of you.
So that's the fat, right?
That's the fat, melted fat.
Wow.
And that's your glands. That was stuck there.
It's kind of huge, no?
Yeah, they're nice. They're like little dumplings. No, they're what are they? What are those? The scallops.
Scallops, yeah.
Little scallops. All right. You had fun during the operation?
Oh yeah.
Good. Good. All right.
Thank you.
My pleasure.